Welcome to our February webinar. We're also happy to have you with us. We have some exciting details to run with you today. But first, we will go to the next slide. And today we had a coffee personality question. So let's see what our results were. And surprisingly, it is a split. A lot over the spectrum here. So we have some definite coffee lovers. But thank you for joining, and we'll go ahead and get started. So for today's agenda, Joe is going to first kick us off with some welcome updates and just some updates as to where we are in the pandemic right now. Then we'll go into some more information, and we'll answer any questions that any of you might have relating to the subaward packages you received earlier this week. We'll also go over some more details about the data collection trainings and what you can expect from those this month. And then our guest speaker today is our partners at Behavioral Science Research Institute, or BSRI. They'll be working very closely with the Sustento team and the clinics to support you for the data collection. So we'll pass over the mic to them for a little bit. And then we will round out today's webinar with some clinic spotlights. So we'll go ahead and get started. So I will pass it over to Joe for a welcome and some updates.
Yes, hello everybody, welcome. It's so nice to see all your faces. It sounds like it's warming up in many places around the country. I'm hoping that will come our way here in New Jersey. It's still chilly, but it sounds like we'll be up in the 60s later in the week. So I'm looking forward to that. Happy Valentine's Day. Happy Mardi Gras. I asked for some king cake from the folks that are down in that area. Maybe they can share some of that with all of us. But I'm just really thrilled to bring us all back together because we are really making progress. Hopefully on Monday, Valentine's Day, you got a gift from Sustento. Everyone should have received the initial part for their subaward HRSA funding package. If you have not received that, please put in the chat that your team did not receive it, because on Monday you should have received your subaward package items. And there is something due today for part one by the end of the day today. It should not take you very long to complete. So please make sure you complete that. That's my first initial reminder. But I just can't understate how hard the Sustento team has been working to make sure that we can get you these subawards as quickly as possible. We know you need the funding. We know how important it is. But of course, we are getting the funding from the federal government. And of course, they have a lot of compliance. So what we want to do is make sure we set ourselves up so that we can ask for more money in the future for you. And what that means is we have to make sure we very closely follow their rules. And we're trying to make it as easy as possible on your side, but that means more work for us. So again, I appreciate all of your patience as we get your subaward packages together and we can execute them. But on Valentine's Day, our love letter to all of our clinics was to get you started to make sure we can get you that funding as quickly as possible. Next slide. So where are we in the pandemic? How are things looking? Well, as you can see, we have just gone through a major surge, which was likely due to the Omicron variant. We are now on the backside of it. You can see that it went up fast. It's come down fast. I would say it really snuck up on us quickly. It disrupted all of our holidays. And now it almost feels like a distant dream in some places. But for us, we know that, it's not something we can really forget that quickly, but the general population is feeling that way. We've seen that mask mandates are being taken away. And I can't totally blame people for wanting to forget about it. There's a bit of cognitive dissonance in that. But what I can say is on the Sustento side, we feel like we are now just strengthening our ability to help you respond. So we are not, even if the numbers are going down, we are not letting up our plans. We are going to continue to make sure we can get this funding out there. We can make sure that we can continue to support you with our tools and services. So while I know people are softening their stance, and that's okay, Sustento is not letting up on its work. Next slide. One of the things I think the Omicron wave said to me, and this is an article from just Monday that I was reading from one of my favorite journalists on the pandemic, Helen Branswell for Stat News. She wrote a whole kind of love letter and a long thing about why the COVID-19 vaccines are a freaking miracle. And I think that is why we're really in a different place today than we were 1 year ago. It's because of the vaccine. And it's an understatement to say how much work went into getting that thing to be approved, to be tested, to make sure that it was safe and effective, to roll it out. It was a Herculean effort, and it's really a freaking miracle, because if you look at the next slide, there's a huge difference between those that have been vaccinated and those that are unvaccinated when we look at hospitalizations and deaths. And so it is clear to me, and I think most people in the healthcare world, that there's a huge difference for how this disease affects a community based on its vaccination rate. And so there are plenty of charts out there. I don't think we need to convince more people about it, but we should be reminded that the Omicron wave could have probably been a lot worse. I know that a lot of folks didn't understand that, wait, I still got COVID. I got a case of it, even though I've been vaccinated and boosted. But we know as health workers that the vaccine is a great tool that we've been working so hard to access our populations with. And it is absolutely making a huge difference when it comes to hospitalizations and deaths. All the studies are showing that. So they're a freaking miracle, and they are helping us to make sure that our communities at least are not getting the severe brunt of COVID if we're fully vaccinated. Next slide. That said, I would say that there is definitely work that we can do with this funding that we're going to be able to distribute out to you to get more individuals boosted. As you can see here, we are at about 76% have gotten at least one shot, 64% have gotten the 2 shots, but only 28% have gotten that third booster. And I really believe, from at least anecdotally, I've heard from individuals, those that were boosted and caught COVID had a much lighter case than those that had not received their booster yet. So we still have work to do. And I think with boosters, we can work on that. And there's still more people, hopefully, that we can convince to get vaccinated. So there's still some work to do on the vaccine side. Next slide. The other thing I just want to say that I'm feeling, and I'm sure all of you are feeling, is that we're at this stage of beyond burnt out for health workers. I'm not sure if there's like a word that we can use to describe what this really feels like, but what does it feel like when you haven't been able to take days off? Your community may not be supporting you anymore as they did earlier in the pandemic. And I believe these are real feelings that health workers are having right now, and it's something that we are going to need to address in the long term. And so while I'm thankful to be part of this network, and I know how amazing all of you are, if you're feeling this way, you are not alone. I have been feeling this way quite a bit. Even when I see someone, some of the public health officials say, oh, maybe we're almost at endemic. Oh, saying those things, I get angry. I get a little bit angry because I know those on the front line are just finally maybe taking a breath after Omicron, but knowing that we don't want this to continue. We really need to figure out a way to get this fully under control and support the front line. And I don't know if we're 100% there yet. So I know that if you're feeling this way, you are not alone. This is how I am feeling often over the past few weeks. And I have one more slide here, but I want to end on a little bit of an optimistic note about, well, what am I thinking? So if Omicron numbers have gone down and we may be in for a little bit of a quiet period, what you see here is a mentor of mine. His name is Dr. Larry Brilliant. He goes, his name really suits him well. He's an epidemiologist. And I worked with him on pandemic response, an organization he helped create for over 5 years. And the one thing that he talked about when he talked about pandemics and outbreaks, he always preached one thing: early detection, early response. That is what we need to move now towards. If we are not in crisis mode, trying to respond to a huge surge in cases, what we can do is set ourselves up for early detection, early response. And so that's kind of been my mantra. And I'll talk just for a second about how Sustento is seeing that and how we want to support you to do early detection and early response with us and support your COVID-19 response throughout this year. So first, on the early detection side, it's all about the data. And so you're going to be doing some new data collection as part of this HRSA project. We also have data points from our helpline and from our free vaccine rides. And what we're hoping is that when we get later in the year, what we can do is track your data about what you're doing on COVID, maybe calls that are coming into your clinic or the number of rides that certain clinics are using to identify when maybe something is going on around COVID. We're really hoping to support you to know in your community if there's potentially an outbreak, if the numbers are ticking up, if there are signs that COVID is coming back, a new variant. we are going to try to work our hardest to use the data you're helping us collect and other sources to do the early detection and know as early as possible when there may be an outbreak or a resurgence of COVID. So that's the early detection. Now, the early response was one that I had to actually think about quite a bit to understand, what does early response mean? And this is what my pledge to you as Sustento is what we want to work with on early response. We want to make sure that you have everything you need to be able to respond if there is a resurgence of COVID. And to me, what early response will mean is that you have tests, PPE, and vaccines ready to go, that it's already with you, you're already having the staff you need to do the response when the time comes. I think so far in the pandemic, what I've seen is we can't do early response because all of a sudden there was a surge of cases and go, we need more tests. There were no at-home tests available. I ordered my tests from the federal government. They're coming this weekend. I ordered them weeks ago. So we didn't have tests on the ready. So what I'm going to be working on over this year or this lull, let's say the next few months, is how can we get a package of support to you, starting with this vaccine funding we're getting you, to make sure you have on the ready the tests, the PPE, and the vaccines that you need to do your job. So to me, things will lull. Things may get quiet a little bit with COVID the next few months. Sustento is not backing down. We're accelerating our work. And my kind of focus is in on this. How can I help early detect things that may be happening in your community and make sure that you all are ready to do an early response when the time comes? And this is something, again, with Dr. Brilliant, I worked on when it was Ebola in West Africa. It was the bird flu in the Mekong Basin. And those principles that I learned there absolutely apply to the work we're doing. So the good thing is we're not starting from zero. I have some extensive experience in how we can actually get early detection, early response working with you. And so know that as you're getting your sub-award packages together, you're collecting this data that we need. You're getting your COVID work continuing to go. This is what Sustento, one of the things we're going to be working on to make sure we don't have to be as reactive, that you can be ready. And in my mind, we can try to stay a step ahead of the virus instead of it being a step ahead of us. So that's my little intro for today. And I appreciate all of you. I'm so excited we're going to be able to get the funds out to you soon, and know our team is working as hard as possible to do that. And I know that Christine is going to be covering that a little bit more right now. So Christine, back over to you.
Yep, thank you, Joe. So yeah, a lot of today's webinar is going to focus on just going through some of the details of the sub-award package to make sure everyone feels okay with those. And then getting into the data collection requirement, which is going to be really the next big lift for this month and next month. So we'll be providing a lot more details on that. So we'll go to the next slide. So again, all of our work is dedicated to this HRSA project, and we're really working on getting this funding out the door to you. So again, thank you for your patience as we work to get this done. All right, quick timeline and check of where we are. So we are in February. All of the clinics in the network, you should have received your sub-award packages earlier this week. Again, if you haven't, feel free to put it in the chat. Megan will be there answering questions as well. So we are asking that you submit that administrative documentation back to us. Data collections are beginning this month. And so you'll be up and ready to start collecting data by March. In addition, in March, that is when you can expect to receive your funding. And again, as we mentioned before, the HRSA funding that is being distributed can cover workforce costs until October of this year. And given how things are changing, this is kind of our next few steps between this month and next month. And in April, we'll be providing you with more details of what you can expect in the following months. Next slide. So as a reminder as to how this process will work, you will be attending a 1-hour data collection training run by the Sustento team. My colleagues Jason and Rose have been working really hard on this training. We're really excited to introduce you to this process. So you'll be attending that 1-hour training. We are also asking you to submit your sub-award package and the necessary documentation. This is all crucial in order for us to be able to distribute the funding. So please keep a careful eye on that. And then again, once we have your sub-award package, that will allow Sustento to transfer the funds to you. So On this slide, we are going to do a quick review of what is in the Subaward package. If you have any questions on the Subaward package, please put them in the chat. In a couple of slides, I'm going to pause for a little bit and take any questions. So feel free to enter them into the chat. But for the Subaward package, there are two components. So many of the clinics, you received your Part 1 package earlier this week. In that package, we asked for your DUNS number, a copy of your W-9, and a copy of your IRS letter indicating your 501c3 status. So that was Part 1. Part 1 is due today, and that will take care of Part 1. Part 2 will be sent out on Thursday, February 24th. You will be receiving this in an email from your state lead. One thing to note, all of the clinics in the network will be paired up with the state lead to help you with some of the administrative paperwork. But please note that this may not necessarily be the state that your clinic is located in. But when you receive that Part 2 package from your state lead, you will see who you have been assigned to. So Part 2 consists of the Sacento HRSA Subaward agreement, a work plan, a budget, invoice, and an electronic funds transfer form to make sure that we can get that money to you. So keep an eye out for Part 2 in your email. And again, you'll be receiving that on Thursday, the 24th. Next slide. Again, more on that state lead support. Your state leads will be helping you submit your Part 2 package. They'll also be providing other support as it relates to the data collection and some of the other things we have coming up in the coming months. But here are the state leads who will be supporting all of our efforts. So I want to give a quick shout out and thank you to all of the state leads for supporting us up until this point in the pandemic and continuing to support us as we get through this HRSA work. Next slide. So Subaward package office hours. If you have any questions or you need any support on your Subaward package, this first link here you can use to sign up for a weekly support hour. These are every week. You can just hop on really quickly and get your questions answered. If you're unable to make that standing weekly meeting, you can also schedule a one-on-one appointment with me to have your questions answered. And Megan will be dropping these links in the chat for you. We'll also be sending out a copy of this webinar, so you'll also have the links there. Joe.
Yes, I raised my hand just to clarify everyone, because we use the word package and I want to make sure everyone understands what that meant. So on Monday, the email that we sent out to your executive that you should have gotten was asking for what we call Part 1 of the package. The Part 1 is the request for your W-9, your 501c3 IRS, and the DUNS number. So if you do not receive an email asking for that, then we do need to help you. If you receive the email for that initial documentation, then you are good. You got the correct Part 1 of the package, and Part 2 will come on the 24th with a correspondence with your state lead, as Christine mentioned. So again, I see a few people saying you didn't receive Part 1. That means, if you're saying that, it means you didn't get any email from Christine. The emails went to the executive, correct, Christine? It should have gone to your clinic executive. So you may want to check with your executive. Hey, did you get that email from Christine that gave Part 1 instructions for your Subaward package? But if not, I think as Christine mentioned, you can stick on with us at the end of the call and we'll make sure that you get it. The Part 1 really shouldn't take you more than an hour or two to complete. So you're not far behind. So if you didn't get it and you're a little worried, I don't want you to worry. The Part 1 is stuff that shouldn't take you too long to do.
All right. And one thing that I do want to emphasize.
One last thing, Christine, I'm going to add is that if you've submitted it, we got it, we're tracking it, we're tracking 100 packages. So Amelia or Rose or Megan will have collected yours. We're kind of splitting this up among the team. So you may have not received a confirmation we received it. I saw a bunch of them coming through. We're tracking all 100 of you. Don't worry, we got you. And if for some reason we're not sure, we will follow up with you. We are going to be on top of it to make sure that everyone goes through together at the same time. So know that that's the Stentos pledge. We're working hard on that. So Christine, back over to you.
Okay, thanks, Joe. And just to reiterate, that email on Monday came from me. And please, if you haven't submitted that information yet, and even with part 2, please take a second to read through all of the directions. Joe has even created a couple of Loom videos to walk you through all of the important parts that you need to pay extra attention to. So please keep an extra eye on that. Double check all of your information before you submit it. That will really help us on our end, just to prevent any back and forth and to make sure that we can get the funding out the door as soon as possible. But again, let us know if you have any questions. But let's see if there's any questions in the chat. Megan, are you seeing any questions or in the chat, or if anyone wants to come off mute and ask a question, we can do that as well.
No, it looks like everyone here is okay. There's just some, like you said, if there is anything about incorrect emails or incorrect contact, make sure that you have that settled before emailing that.
Okay, perfect. Again, if questions kind of come up as you're looking through your email, we'll stay on after this call to answer questions. Or again, you can use those links to follow up with me. All right, next slide. Okay, so I want to spend a little bit of time pivoting now from the subaward packages to now to the data collection requirements. So as part of the requirements for this HRSA, there's a couple of main points that I want to talk through. So first of all, our team acknowledges that data collection is not the most exciting thing ever, but we do really want to iterate that this is really important for this work and for the funding. So we want to be clear that in order to receive this HRSA funding, data collection is required. Again, your clinic doesn't necessarily have to be administering vaccines on site, but there are some other data collection points like COVID-19 outreach and education that we will need you to report on. So again, in order to receive the funding, data collection is required. The second thing that I want to mention is that in order to make this data collection requirement as seamless as possible, you will have a dedicated team, not only from Sustento, but also from our partners at BSRI to help you with the data collection work. We will be very communicative with you. We'll be checking in with you. So just know that you do have a big support system behind you to make sure that everything is on track. And then lastly, one other thing to note, please know that no identifying health information will be collected. So all of the data collection and data that you're submitting is anonymous and confidential. But a lot more of these details will be covered in the training, but this is just to address some of the more major things. Next slide. And so you might be asking, why is this data so important and why are we emphasizing it so much? The first one is that it clearly communicates the impact that clinics have to HRSA. We really want the data to speak for itself and for the importance that free and charitable clinics play in their communities and in the pandemic response. And to give a clear example of why the data is so important, we first want to say thank you for continuing to submit your PFL monthly surveys. That data and those metrics allowed us to advocate for funding and to demonstrate to HRSA the power that free and charitable clinics have. So we want to make sure that you continue to get the credit and recognition of your hard work. And we also want to show HRSA to continue investing in this network past this project. So that's the first thing. The second thing is that it provides best practices evidence. So the data that you are submitting is going to help Sustento and our team better support your data collection efforts. In future webinars, we'll be sharing across the network best practices, what's working, what's not working, some tips and tricks that clinics have come across along the way. So that'll be really important for us to share best practices across the network. And then lastly, as Joe had touched on, this data will help us identify outbreaks and other trends early. So the data will be kind of our guiding light, and we'll be able to tap into the data trends, which will allow us to support clinics to make sure that they have what they need before an outbreak occurs. So this is why the data is really important, and we have a team behind all of you to support this effort. Next slide. So some of our data collection principles and what our team has been doing behind the scenes to try to make this process as easy as possible. So first, we have worked to provide you the data collection forms in Google Forms. So it's a similar format. This is not the original form that the data forms came in. So we wanted to provide something that you would feel comfortable going into and submitting the data right away. So those will be in the form of Google Forms. Our tech team has also been working nonstop to try to automate as many things as possible with this data collection. And this includes the Google Forms being pre-filled. So it'll minimize your need to memorize any information, and it'll kind of automate a couple of things for you. And then lastly, we are also providing multiple modes of collecting the data. So in Google Forms, you can typically pull it up on your web browser. We're also providing processes so that you can pull it up on shared clinic devices such as iPads. And we'll also be providing a printable version of the form in case, let's say, your internet goes out or you don't have enough clinic devices for everyone in your clinic that day. It's a little bit busy. There are also other workarounds that we'll be providing. Next slide. And throughout this data collection process, you are going to have a robust team behind you to make this as easy as possible. And to ease any anxieties that you might have, we're here to help. And so everyone who will be in your corner supporting your data collection efforts are all four of these listed on this slide. So first, you will have our Sacento data team, which will continue to work on the data collection tools to make sure that they are effective and as easy to use as possible. Second, you will have your EVN state lead. So again, this may be a state lead from a state that you're not located in, but your state lead is going to help you to keep on top of your administrative paperwork. They're also going to share data collection best practices discovered from the network. Third, you will have the Behavioral Science Research Institute in your corner. BSRI will be supporting clinics to ensure that you're successfully implementing the data collection and to support any maintenance of any data collection practices. So they'll really be in close contact with you. You'll get to know each other really well, and they'll be someone who you can go to if you have any troubles. And then lastly, as always, we have our clinic network. So we will be doing something similar to like clinic spotlights that we've done in the past, but we'll be sharing best practices from clinics. We'll be hearing from you of what's working, what's not working, things you wish you had known earlier. So we'll also be sharing some of that collective knowledge as well in future webinars. So in terms of next steps and where we go from here, first thing is that you can expect to receive an email with a sign-up link to attend a training session this month. For these sessions, we are asking that you have your clinic executive attend. We also ask that you have a person, the person who you anticipate to oversee your data collection also be in attendance. This training session will provide you an overview of everything you need to know, any information you need to pass off to other team members. So we do ask that you have those two people attending. And again, we urge you to sign up for training as soon as possible. The sooner you get onboarded, the sooner that we can start documenting your data and have that coming in. All right. So now that you have a little better sense of the data collection component, we have our guest speaker today, which is Angela from the BSRI team. And so again, BSRI, you may recognize them. They've attended some of our webinars in the past. We've also worked with them pretty closely on other projects, but we're really excited to have the support from their team. And again, their team will be working very closely with clinics to support your data collection efforts. But for now, I'm going to pass it over to Angela to tell you a little bit more about their team and the work that they'll be doing.
Hi, everyone. So I'm Angela. I'm the executive director at BSRI. This is our team. We are a fellow nonprofit. We're based out of Miami, and we are a research and evaluation organization. So we don't provide any direct service, but we've been working, the organization itself has been around since 1976, and we've been doing data infrastructure evaluation, research support for federal grants that entire time. So this is really where we have expertise, and we've been partnering with Sustento since before Sustento was in existence. We've been partnering with Joe and his team on a number of initiatives, and we're just really excited to be a partner here and doing this type of work alongside all of you. So we're, as a fellow nonprofit, we really believe we're set apart because our work is really guided by our foundational values. And among those are community collaboration, social justice, integrity. So in particular, this work with free and charitable clinics is so closely aligned to our mission because of the communities that you're serving, because of your unique expertise in working with these communities. And that's, we bring expertise in evaluation and federal reporting, but we don't have the expertise that you have. So we're really interested in learning from you all and helping to refine and tailor the data requirements from HRSA to fit your organization's flow and processes. Because we know that the data burden from the feds when it comes to grants can be severe. For any of you who have experience in grants, there's usually a hefty reporting requirement. This case is no different, but really what our role is going to be is to provide targeted support so that we can get HRSA what they want. And also we can showcase all of the hard work that you all are doing. Right, so essentially after the training that Christine talked about, it's a 1-hour training, BSRI, a team member from our organization is going to be attending those right alongside with you. So you'll get to see someone's face at those trainings. And after that, we're really going to be your point contact for all things data, anything with the forms, anything with getting the data filled out, double checking that the data was received. And then also getting that feedback loop, like, wow, you did 13 outreach events last month. That's amazing. Let's tell her some more about that. It's really to serve as that feedback loop. We want to be able to give you the data so that you can use it to leverage more funding, to shout out on social media. We want you to have that power and that control. And we also want to get HRSA what they want so that we can showcase the value of this whole EVN initiative. So our team is going to be 5 people, including myself, and one of us is going to be your point person. And so we will be connecting very frequently to talk all things data. Like I mentioned, we will be attending the onboarding. We've also created a data manual that is very thorough and gives screenshots and guidance on how to complete all of the unique individual forms that HRSA is asking for. So this is really going to be your go-to reference guide. You don't need to absorb it all in that onboarding. If you have other people that are going to be on your team, this is a document that you can share widely. But again, no need to memorize it because we're going to be right there with you. We're going to walk through it together. We're going to go through it. We're going to troubleshoot. We can even do some of the data together, the data entry together, just so that we both get a feel for it. And then again, one of our team members is going to be your data liaison, and that's going to be myself, which is Angela, Sierra, Natalie, Bao, and Carlina. And I know that some of them are on the webinar now, so you might see a familiar face, but one of us is going to be your designee, and that's going to be your point person. So we're giving you like a full dedicated person to go through this process and support you. All right, I'm happy to field any questions if anyone has them.
Thank you, Angela. Yeah, if anyone has any questions, please feel free to put them in the chat. But thank you so much to Angela and the BSR team for joining us today. You'll be hearing more about the data collection from them, and they'll be in touch shortly. But for now, let's take our 5-minute break. Megan is going to drop into the chat your January survey, your monthly report, if you have not completed that already. As a friendly reminder, please continue to submit those until we are fully transferred over to the HRSA data collection. But we'll play you a little bit of music and we'll see you back in 5 minutes. All right, welcome back everyone. We'll go ahead and get started again. Next up, we have our clinic spotlights. So we have 3 clinics to spotlight today. Next slide. The first one that we will hear from is Billy Edmonds from Free Medical Clinic of Oak Ridge.
Sorry, my 5-minute countdown was off.
No worries.
It's so good to see everybody. And we, in the Free Medical Clinic of Oak Ridge that serves Anderson, Morgan, Roane County, and Appalachia, Tennessee, has 3 clinic locations in Oak Ridge, Harriman, and Briceville. Briceville was one of our newest clinics. I wanted to tell you a story about how Project Frontline has helped during that time. Right when we started Project Frontline, we did our first COVID-19 event in Briceville. It's a rural town that used to have coal mining that now is out. They don't have a thriving business there. There's around 700 homes, and there's not even a clinic in that area if you have insurance, let alone if you don't have insurance and are serving the low income and insured like we are with no charge primary care. So we did our first COVID event there, not really knowing how people would respond and react. Our first person to get a vaccine, his name was Charlie. And he said he was about 73 years old. And he said, I walked 3 miles to get here to this clinic. Now, it was right in the middle of the summer, and it was very hot. And if you're down in South, you say, bless your heart, because sometimes you believe them, sometimes you don't. And so I said, bless your heart and all that kind of stuff. Maybe he really didn't walk 3 miles and that kind of stuff. But we gave him his sticker. He got his vaccine. He was in his 15-minute wait. And I said, Charlie, why don't I drive you home? And that way you don't have to walk back. You'd really do that? And yeah, and I gave him some snacks and stuff, and we were serving hot dogs to people that came through. And I thought, we'll just see how close this man really is. Well, guys, he was 3 country miles away. And I asked him on the way, I said, Charlie, why did you come get the vaccine today? He said, Billy, I don't have any transportation. And I've always wanted the vaccine, but it was always too far to walk for me to get it. And when I heard that you all were doing a vaccine, COVID-19 vaccine event, I said, I'm going to walk there and get my vaccine. That's the kind of people that we are helping in rural America, not only from the Free Medical Clinic, but an extension of Joe and his team. And that's just a quick story to say we've done 46 of these community events now, giving out the vaccine boosters, Pfizer, Moderna, and not only that, but also the testing that we're doing, which, as you all know, it'll go from a lot of people wanting testing to a few people wanting vaccine to a lot of people wanting vaccine and no one wanting testing. It's just a wave. And some of the challenges we faced, we were the first clinic last February to be selected because of our strategy, because of our resources and our team to give vaccines in clinic, which is one of the first, as they were giving in the community, but we were giving them inside the clinic as well. And we're so proud of that. The challenges we faced are the challenges I'm sure everybody has faced. But the key is being determined to persevere through this pandemic. And we could not do it without TCCN, without Mary's team. We could not do it. We know that our team is so much bigger than our staff and our volunteers and our donors and our partners. It really is the extension of how we can make an impact in our community and across the nation, because we are connected together. And we just want to take this opportunity to thank you all, and let's keep going. Let's don't stop. And thank you so much for this time to highlight what we're doing. We appreciate it very much.
Absolutely, Billy. Thank you so much for sharing. And I think those stories of, vaccines are really hard to do nowadays. There's, numbers are going down. The stories like that just shows how important each vaccination and each person that you all reach is. So thank you so much for sharing that with us. It's extremely uplifting. And I know a lot of hard work is going to come in the next couple of months, and we're going to continue to hear those awesome stories. So thank you so much for sharing. Our second spotlight for our webinar today is Julia Pierce from Mountain Hope Good Shepherd Clinic. Over to you, Julia.
Thank you. Hi, everybody. Just wanted to touch base, and I'm going to follow the format of the questions that we were sent. So we're Mountain Hope Good Shepherd and located in Sevierville, Tennessee. We're a charitable care clinic that serves people that live or work in Sevier County and are uninsured. The population of the county is close to about 100,000 folks, but we work in Sevierville, but we draw from the cities of Pigeon Forge, Kodak, Cosby, Pittman Center, Seymour, and the Gatlinburg areas. So you can see that because we're a tourist county, we have this 100,000 people that we get visited in the national park, Smoky Mountain Park, to over 14 million people this last year, the largest visited park in the United States. And we end up having hundreds of thousands that go through our centers in Tennessee just for tourism reasons. Our clinic provides primary care, dental care, medication assistance. We also do women's health and some behavioral health. And we've recently expanded our services to include 2 community health workers. And the addition of the health workers is something that's impacting our COVID vaccine program. They are in part hired to do outreach and education, coordination and linkages to both patients and community. So a part of the processes that we started is that they're calling any new patients and asking them about some of the barriers that they might be experiencing as part of the social determinants of health. And in the course of that conversation, we're talking about the COVID vaccine, if they have any concerns or if they have any need or want for information, and can we pursue and answer those questions for them. Since we started with Socento last June, today we have had our 47th vaccination clinic, and we've had some success because the consistencies, like Billy, we're providing services on a weekly basis. I think the downside is sometimes when you have something that's consistent and people know it's going to be every week, is that maybe, oh, I won't go this week, although I've said I'm coming, I'll go next week or 2 weeks from now. So we have not turned anybody away. Our pop-ups have not been as successful as our on-site clinic events. And I think it's because we've been tasked to go into areas where there's a lot of vaccine hesitancy, and that's more prevalent. And so we've had partners that are eager to work with us to have these events. But once you get into that community and you just don't have those events well attended. So we're working on some strengthening of our partnerships that way so that we can do our due diligence to make sure the right people know that we have the event going on. We've probably had our greatest response from the Hispanic community. To date, over 50% of the patients that we vaccinated have been Hispanic. And so we're pleased that we're the provider of choice and trust for those individuals. And they've been good to work with. I guess my little story is that we had an older woman who was a grandmother that called to say she was coming in for the vaccine. So all was good. I went out to talk to her, and it wasn't so good. She was extremely nervous, and you could just see in the eyes, because that's the only thing you can focus on when people are wearing masks, that she was having some concerns. And so I talked with her, told her I was there to answer questions and the provider could answer questions and such. And she just kind of got all shook up and she left. And so I called her back a couple days later just to see how she was doing. And then the week after that, I called her again, just checking in, making sure if she was doing all right and if there's any other questions that had popped up that she needed some responses to. And then she did come in, and when she got her first vaccine, she was thrilled. So we had those COVID vaccine stickers that we gave out. And so she proudly went out, came back for her second, and has already come back for the booster. And she's just so proud of herself for having overcome her fears to go ahead and have the vaccine. As we move forward with our opportunities, we have several events that are scheduled for us to do education and outreach in businesses and schools and churches. And so we're hoping that those partnerships grow into some events, but we'll always be promoting the COVID education, as well as knowing that there are places besides us that are providing vaccinations. And because we have a community in which we have very limited public and private transportation, we are moving into giving gas cards to those folks that have those barriers. And so we're hoping to see some positive with that. And we're looking forward to being able to offer that assistance to patients. We also have had a lot of folks that have had their 2 doses, so we can do some outreach for those if they're interested in the booster. We're also checking the vaccine status of patients that are living with chronic diseases with different organizations to see if we might be able to move in that direction. And we are scheduled to go to the jail to begin a program to educate inmates that are being discharged to create a bit of a care plan, and in that educate on the COVID vaccine and the opportunities that they have to get vaccinated. So we're hoping that will be a successful partnership.
Thank you so much, Julia. There's a lot going on at your clinic and some really awesome work happening. So we're always excited to hear how things are going. Thank you so much for joining us. Our last and final spotlight for this month is Arman over at Muslim Community Health Center. Over to you.
Thank you, everyone. Thank you, and hello, everybody. To begin with, after hearing these seminars on a monthly basis, I really wanted to thank you for the great support Joe, Christine, Amelia, Rose, all of your team has done. It's really phenomenal. It has made our clinic and our team very happy to have such a great support, which we are proud of, and we talk a lot about during our committee as well as our board meetings. MCHC is a nonprofit community health center. We take care of every single patient who walks through our double doors, whether you have insurance or you're self-pay. So we are free, charitable, and low cost, providing a community health center which has family practice, internal medicine, a full-fledged behavioral health department, a moderately sized senior center with about 90 senior members, and a refugee resource center. So these are the arms which we work with. We have been in existence since 2004, but that was a very small social service organization. The actual clinic started in 2008, and 2015 is when all of these other departments were included. We have a team of 7 physicians and 3 nurse practitioners, as well as some licensed practicing counselors. Very happy to be a part of Wisconsin Association of Free and Charitable Clinics Association member, and have learned a lot of how to run organizations through some of the meetings we've had. We have a board which is of about 11 members, and very, very happy to say that they are one of the most guiding people we have worked with in order to have some of those successes and some of the challenges we've faced to get help from. We have about 46 hours of clinic a day, a week, where we take care of patients from all walks of life. We also are very proud to say that, just this December 2021, we passed about 10,000 vaccines for COVID vaccines, which we gave, and are still continuing to give vaccines. Our average is about 60 to 80 a day, has fallen in February since the number of people who we have vaccinated has gone down. But 2021, starting from January of 2021 through December, was really a phenomenal task which our team led. I always tell people you can only clap with 2 hands. It's not just one person. It's actually our entire team who has done a phenomenal job. We are a vaccinated clinic by DHS standards, as well as a COVID testing site. And we have just crossed a little over 3,500 COVID testings we have done. We do rapid as well as PCRs as well. We take care of men's health, women's health, all kinds of DOT testing, point of care testing. We are urgent care, and we have also started a specialty in cardiology. So we take care of a lot of patients with cardiology as well. One of the great stories which I wanted to mention to you was that we are the only clinic, God be thanked, and to our team as well, which gave a vaccine to the first lung transplant patient. We had a patient who actually came in upon referral from another primary care that she needed a vaccine. This was her first vaccine, and she was actually a lung transplant patient, a bilateral lung transplant patient, both lungs. So it was a great opportunity for us to not only help her, but also to learn, as this was the first patient who we were using. And we had media and everybody who followed her from obviously being a huge thing for a Wisconsin based small clinic. And then she's now got her second shot and her booster, and obviously is doing very well and is very, very happy and proud. We also are the one who actually gave a lot of Packer players their vaccine, and one of them is in the Hall of Fame route now. So that was another very interesting thing which happened, very impressive, for the team members who really worked hard to do that. We basically take care of a lot of refugees, There's the highest Burmese population which lives on a zip code, 53221 in South Milwaukee. About 4,000 families are here from different parts of the world which have come and settled here. So we do take care of a lot of them. We are very happy to take care of them. We speak about 12 languages in the clinic. Mostly it's Burmese, Rohingya, Swahili, Somali, a lot of Middle Eastern languages, Urdu, which is South Asian, and obviously English, which is a part of our first language. So all in all, in general, it has been a great experience. I would like to thank you for being such a big support, Joe and the whole team. As I always mention in my monthly reports, that with your support, it has been easy for us to have additional hours so that we can have our vaccinators at site. We are able to purchase things, especially, one of the biggest things we really benefited from your support was the COVID vaccine testing equipment, a lot of different PPE equipment, which is very, very expensive, to be honest, for a clinic of our nature and size. We depend on mostly Medicaid reimbursement and annual fundraisers and support and grants. We write a lot of different grants, and we hope that when we receive them, that we can use that. We have a lot of volunteers who also support our clinic in many different ways. But I would like to again say thank you much again. This is a little about us, and hope that we're able to work with your organization in future as long as we can. We try to do everything under one roof, seeing patients. We have an on-site lab. We work with a local lab in Milwaukee, which provides us with all lab testing, although the phlebotomy is done by MCHC. We have some local radiology offices which also help. And to end of all, we just submitted an application to become a HRSA approved lookalike FQHC site. And if we are approved and if all goes through well, then hoping that we would be an FQHC lookalike site by fall of 2022.
Amazing work. And thank you so much for sharing. And it sounds like a lot of amazing things are on the horizon as well.
Thank you.
So thank you very much. All right, that rounds out our clinic spotlight for this month. We'll be doing another round, of course, next month. But in terms of next steps, we'll end the webinar a little bit early, but some takeaways and next action steps. If you haven't completed your January report, please do so as soon as possible. The link to the report will be in this webinar deck in case you need it again. Secondly, get prepared to attend a data collection training. We're going to get these rolling this month. So think about, you'll have your clinic executive there, but think about who might be your clinic liaison who will be overseeing the data collection process. And a link for that training to sign up will be sent out shortly. Third, mark your calendars for the next upcoming webinar. That's going to be on Wednesday, March 16th. 1 to 2:30 p.m. Eastern Time. And lastly, Subaward packages, part 1. If you received them, please submit them to us today as soon as possible. If you haven't received them, I've gotten some messages in the chat. I will follow up with you and get those to you. You can always shoot me an email in case you haven't received that as well. But that takes care of our webinar for this month. Our team will be online for a couple more minutes if you want to stay back and ask any questions. If not, we'll give you a little bit of an afternoon break. But thank you so much for joining us, and we'll see you next month.
Thank you.
Thank you, everybody. Good luck.